Good morning, everyone. Good evening, everyone. And it is my pleasure to introduce today's speaker, Dr. Sobiha, for this online health talk in observance of World Tuberculosis Day. Dr. Sobiha is the head of Department of Psychology at JSINYS, bringing with her 7 years of valuable experience in the field of naturopathy and yoga. Her expertise and dedication to holistic health make her an inspiring voice in today's session. Today, she will be sharing her insights on World Tuberculosis Day, helping us understand better the importance of awareness, prevention, and overall well being. Let us warmly welcome her. Over to you, ma'am.
Good evening, one and all. Today, the session is all about tuberculosis. So, before going into the topic, today it is considered as they are mainly focusing on prevention of tuberculosis, how we can prevent it early. So, that is the theme for this year. So, first, before going into the Yes. So let's start the session with a bit of introduction about what is tuberculosis and how it spreads. What are the myths which are there in spreading of tuberculosis and everything? So first, in simple words, when you see tuberculosis, it is nothing but a germ infection. The germ called as Mycobacterium tuberculi, which is causing the infection, particularly in lung. So this will develop as a full-blown TB when it is not treated properly. How and all it can spread? The first thing is the source should be there. That is the person with active tuberculosis. And when you see the mode, it is completely a airborne droplet infection. That is through cough, sneezing, and talking when the saliva is like transmitted, it causes TB. And entry point is through breathing only, that is, it is going to affect the lungs. Risk group, when you see where people who are in close contact with active TB patient and people who are with low immunity, and when the environment is too much crowded and poorly ventilated, it can easily spread. So what is actually the myth? When you share the food, TB will be transmitted. So that is not going to happen. Touching the hands will not spread TB, and hugging each other will not spread TB. Even sharing the clothes will not spread TB. The only mode of transmission is completely airborne, that is droplet infection. So the next thing is how much prevalent TB is in India. When you take globally, 27% of TB cases are noted in India particularly, and it is almost among 4 TB patients, one will be from Indian population, and 10 to 15% is kept undiagnosed and they are not reported properly. So because of that, the care is not given properly. So why it is very much important to know about the statistics and why it is very much important to analyze it. So lack of diagnosis, it leads to more of spreading, and lack of awareness will delay the treatment, and that may cost the life of one person. And the social stigma which is prevailing, that if a case with a patient with TB is reported, still the social stigma is there, treating the patient in a different manner. So because of this also, there is lot of undiagnosed and unreported cases. So this is the world level TB thing, particularly in India. When we go into the recent years, 25 to 26 years, India is almost contributing up to 25 to 27%, and the Comparatively, the incident rate has been reduced to 21%. So almost around globally, when you see 26 to 27 lakh people are reported annually. And when you take the treatment success rate, it is almost 90% when it is diagnosed properly and treated properly. So when you see the mortality rate, the death rate, it is almost 21% per lakh population. So this is the statistical data till now they have given. Now going into the signs and symptoms of TB. What is the basic signs and symptoms when you see? When you have cough, continuous cough more than 2 weeks and associated with fever, particularly during the evening time, an unexplained weight loss, when you don't have proper appetite, and sometimes you may see blood in your mucus. You are spitting the mucus, you can see the streaks of blood. So if in case these are the major symptoms you're going through for 2 weeks or more than a week, it is very much necessary to go and get tested for your TB. What are the basic tests they are using? They are using your sputum, the phlegm which is coming out for test and chest x-ray and some advanced tests to confirm your TB case. All these cases are, all these treatment diagnoses are available in government hospitals in free of cost. So you can easily go and get diagnosed when you have all these signs and symptoms at least more than a week. Okay, so when is TB curable? Yes, of course it is curable. Almost the treatment is for 6 months we are giving. That also may exceed according to the immune of that person. And medicines are all given under government full free of cost. And the one thing you should not do is you should not stop the medicine without the consultant of a doctor. So, what are who are the high risk patients? The people with low immunity and people who are diabetic and smokers, mainly malnourished individual where they don't have a proper nutrition supply, they may also get affected with TB. And people who are in close contact with the TB patient and also they are immune suppressant. So, all these conditions, all these people are at high risk of TB. So how you can prevent this TB? First is vaccination from the childhood, from 1 year BCG vaccination that people should take. And if in case the any signs and symptoms are there, you should not ignore the signs and symptoms. Go for early diagnosis, and this will also help you to prevent the spread of TB. And early contact tracing, so whom and all got recent contact, so you can check for them also to prevent the infection from the further spreading. And targeted proper diagnosis should be taken. Sufficient rest should be taken, balanced diet should be given, and moderate exercise, maintaining personal hygiene. When you maintain all these things properly, we can easily reduce the spread of the TB, and we can also bring back the patient from the uh, disease to normal condition when we take all these things, all these measures properly. So this is the government scheme which is given particularly for TB patient. The first one is National TB Elimination Program. This is particularly used for free TB testing and free medicine, complete treatment support. You can approach this program. And second one is Nikshay portal. Once you are getting diagnosed with TB, you can download this thing, and where the TB patients are getting registered and regular tracking of their treatment and all the benefits what and all they are getting, everything will be monitored under this portal. The third one is the Nikshay Poshan Yojan. So in this scheme, the TB patients are given rupees 500 per month for their nutrition support particularly. So this also you can apply. Next is Nikshay Mitra. So this is to adopt and support TB patient with their food, their emotional support and care for all those things. They have introduced one scheme called as Nikshay Mitra. And next thing is INTB Mukt Bharat Abhiyan. So this is for public awareness and community participation to eliminate TB. The social program they are conducting under TB Mukt Bharat Abhiyan. And if in case you want to diagnose or you want to go for diagnosis, you want to tell about some TB patient, you can use the TB helpline number which is given here. This is to get information and get guidance, and you can easily approach them for nearest TB service area where and all we can get all those information they will tell when you call. Next is BCG vaccination, we know. So this is to protect the children from severe form of TB. So this government has introduced this vaccine scheme. And next is the active case finding, ACF. This is actually door-to-door TB screening for early detection. This is also a government program. Then is the TPT, TB preventive therapy. So in this scheme, what they are doing, they are identifying high risk peoples and family who are in contact regularly and low immunity. They are giving proper nourishment and treatment for this kind of people to prevent the occurrence and further spreading. So these are the basic important schemes which is given by the government, particularly for TB patient to help and to come out of it. So patient with TB can all use all these things regularly. So how you can go approach this schemes? So first, when you are with symptoms, go to a nearby government hospital or primary health center, get the testing done, that is TB testing through sputum, X-ray or any advanced testing. Once it is confirmed, you have to first register in Nikshay portal. So once you register your name and everything in Nikshay portal, you will have regular updates about the programs, new programs, what is coming, and already existing programs. Everything will be there. Then from there, your free treatment, TB treatment will be started. And once you register in that Nikshay portal, you will get 500 per month for particularly for your nutrition support. Then after that, you can reach out Nikshay Mitra if you want. Then regular monitoring and follow-up will be given until you complete the treatment, until you are getting reversed back from the condition. You will be completely monitored by all these schemes. The important thing is you have to register your thing in Nikshay portal. From there, your continuous monitoring starts. Okay, so this is all about the modern aspect. This is all about the actual TB. What is TB, signs and symptoms? What are the government schemes? It is there. So how naturopathy is going to support in this condition, we'll see. So naturopathy, in case of TB care, it is not a complete care which is we going to give. We are going to support the patient with all our naturopathic inventions to support their immunity, to improve their nutrition, to enhance the recovery, and to prevent their weakness. So for all these things, we are using our naturopathy not as a standalone treatment. Along with the drug therapy, we can give the supportive care for easy and complete recovery. So TB treatment should not be stopped in between, and the drug should not be stopped. Along with those things, when they are properly guided by a naturopathy doctor, it is very much easy for the patient to revert back to the normal condition. So how the integrated approach can be given after the diagnosis, you can start with your anti-TB treatment, which is given by the government, and take some naturopathy support. So this is going to improve your immunity, This will check out your nutrition and this will help you in the complete recovery. Then after that, obviously, when you take this holistic approach, you will have better energy and faster healing, which is going to help you in the complete cure. So, what are the aspects which where yeah, the naturopathy can come? First is your nutrition part, which is very, very important in case of tuberculosis because it is one of the most starving disease. So, nutrition is very much important. A balanced meal should be there. So, what and the second is all other naturopathic treatment, which we'll see one by one. So, first is your nutrition part. What are the things you have to eat more in the sense good amount of protein and good fat, like sprouts, groundnuts, dal, milk. If you are a non-vegetarian, you can go for egg, then green leafy vegetables, fruits, and small amount of good fat like ghee. All these things you can take. When you take this kind of high nutritiously dense foods, it helps to help you to gain weight, to maintain the weight, and it will help you to improve the strength, and it will help you in faster recovery. So what are the things you should not touch at all is your junk and fast foods. Too much of any sugars, refined sugars, you should not touch, like soft drinks, sweets, chocolates, bakery items, pastries, you should not touch. Then fried and oily foods, alcohol, and so, smoking, tobacco you should quit. Then too much of tea and coffee, very spicy food, and stale and unhygienic leftover contaminated food. All these things you should not touch at all. Here it is not about reducing all these things. You should not touch all these foods. You have to shift your diet completely into a nutritiously dense diet. So, why it is very important, the nutrition part? Because tuberculosis is nothing but it is going to put extra stress on your body due to recurrent infection, fever, reduced appetite, and the medication effect. Everything will be there. This is going to put so much of stress in your to your internal organs and your body. So because of this, what happens? Your energy drops and almost losing of weight will be there. So to combat all those things, nutrition, the nutritive food, what you're going to take is going to impact you more than anything. So what are the basic things you have to check if you are a TB patient? Particularly, protein should be more, like higher intake. It helps in your complete repair of your whole body. And you have to check for proper calories, not the junk calories what we are eating. The proper calorie from highly nutritious food. You have to check for your calories first for your protein. The next is your micronutrients, your vitamins and minerals. That is going to support your immunity and it helps in your recovery. The proper, when you take all these things, you have better weight gain, faster recovery, and the improved treatment outcomes will be there. So what to eat? You have to eat protein-rich foods, highly energy-rich foods. So protein-rich foods are being more the what and all the things you can have. You can have, if you're a non-vegetarian, you can have fish, chicken, eggs, and all those things. Don't go for red meat. So you can go for complete protein and micronutrient-rich foods. And that second thing is your dal, chickpeas, soya, paneer, milk, curd, not all these things you can take. The main important thing is in every meal, from your morning breakfast till your dinner, you should have a portion of protein in every meal. You have to keep that in mind. The second thing is high energy giving foods like to recover you from the weakness and weight loss. You can go for good quality of ghee and butter, not the processed one, and you can go for full fat milk that is also in a restricted quantity. You can go for good paneer. Everything should be from a maximum organic source. Next is your nuts, dates, and raisins. You can go for some energy-giving fruits like banana and all those things. You can eat minimum quantity of rice and pulses, all those things. So how you can take this energy giving food frequently? You can take small portions, frequent meal up to 4 to 5 meal per day you can take in a very small portion. Chew that properly. Each thing should give energy. So next is your vitamins and minerals. Most important vitamin you have to check is vitamin A, C, and D. That this is going to improve your lung health, your immunity, and the infection. Vitamin A, we all know carrot, spinach, and rest other things. Vitamin C rich and vitamin D. Next is your micro minerals like zinc and iron. Zinc rich in nuts and seeds, which is going to improve your immune strength, and iron greens and jaggery dal, all those things you can take for iron. Then you can go for natural antioxidant healing rich foods like turmeric, ginger, garlic, which is going to help in reduce your inflammation. Then proper homemade curd, which improves your digestion when you are in medication. Then you can go for if you want to drink tea or anything, you can go for some herbal tea supplements or green tea or even dry ginger tea, which will improve the antioxidant. So these are the important nutritive part which you have to check out. Go for proper protein and proper vitamins and minerals. The meal should be, you can take 4 or 5 meal in a day in a very small quantity. Chew that properly. Each meal should be digested. So then you can expect good absorption that will improve the strength of your body, and that will also help you in recovering the condition faster. This is all about the nutrition part. The next thing is your sunlight exposure, which is going to improve your immunity to the maximum. You can sit in the morning sunlight for 15 to 20 minutes daily. This will improve your immunity to the maximum when you're taking this continuously. Keep yourself hydrated when you are under the sun. So 15 to 20 minutes daily, you can go for a walk in morning sunlight, not in too much of sun. A subtle morning sunlight you can take. The third important thing is breathing. So breathing is going to improve your lung capacity. So it will improve the intake of air. So, what are the basic breathing techniques which are actually important and which is actually given to various condition, TB, and all those things? The first thing is your diaphragmatic breathing. It is a deep breathing technique. You are going to breathe slowly using the abdomen, filling your abdomen with air when you inhale and emptying your abdomen as you exhale. This is the first breathing technique you can practice. The second thing is pursed lip breathing. You are going to inhale through the nose and exhale slowly through your lips, keeping your lips in pursed position. So this is also improves your breath capacity. And next is your segmental breathing. You're going to breathe in from specific parts of your lungs, slow and a deep breathing. Next is your controlled coughing technique. So this is like not forcing the cough, stopping the cough. You're going whenever you have continuous cough, you have to deeply inhale. You have to deeply inhale and control your continuous cough, not forcefully, gently you can do. The next thing is Anulom Vilom Pranayam. It is nothing but alternate nostril breathing. You're going to inhale through the one nostril and exhale through the other nostril. All these breathing techniques are very much beneficial when you are practicing under a proper guidance with proper instruction. So these are the techniques you can note and practice regularly. Next is a mandatory thing, rest. So you have to sleep at least 7 to 8 hours. the proper deep rest should be there. Avoid extra stress, and this will improve the immunity, thereby improving the condition. Next is, when you are with the family, try to cover your mouth while coughing, and you can wear a mask. Try to keep yourself in a ventilated area. Don't keep yourself crowded. Next, you can go for some natural immune support. As I mentioned earlier, amla, your turmeric milk, and garlic, moringa. So all these things are going to improve your immunity to the maximum. So you can take all these things. What and all you should not do when you are taking medicine along with the naturopathic treatment. You should not stop the medicine, and you should not skip meal, and don't go for heavy fasting. Already your body is under starving condition. You should not go for heavy fasting. Then don't, the basic important thing is, don't ignore the symptoms. Try to get it diagnosed earlier. Okay, so these are the naturopathic point of view, which you can take along with your actual TB medication, which is going to drastically improve your condition without any doubt, starting from your nutrition and nature exposure with the breathing technique, your rest. All these things will play 70 percentage role in the recovery of your condition, and also to help you from the side effects of the medicine. So it is very much important to consider all these things when you are taking TB treatment. So this is the basic diet chart, which is high in protein and high in good calories. So it is a 7-day diet chart. So first, day 1, day 2, and till day 7, it starts from early morning juice to bedtime drink. So early morning, you can go for some good vegetable juice, sometimes fruit juice or coconut water, as mentioned here. Then breakfast, you can go for good portion of protein, fiber, along with micros. That is also mentioned for all 7 days. When you are non-vegetarian, you can include egg, you can include proper grown chicken, and you can include fish, all those things. Lunch part, it should be a complete balanced meal where you can take good amount of good rice, dal, some vegetable, curd, and some quantity of protein. Evening snack, again, you can go for some protein rich snack along with some fiber. And dinner, also, you can go for some good amount of complete diet. And bedtime, you can take turmeric milk, which is actually going to improve your immunity, and this will calm you, which will help you to give better sleep. This is the simple basic 7 days module, which you can use along with your treatment, which help you in faster recovery. So this is the complete basic understanding about the TB condition and how you can come back with it. So when you take this condition, it is not only the medicine which is going to help you in the recovery, the things which we saw till now, starting from the diet, the sunlight exposure, basic exercises and breathing pattern. This is going to shift your whole body condition in a very positive way, which is actually impactful in your treatment. So along when once you start the TB treatment, you can consult a good naturopathy doctor or a consultant, where they will guide you through the process, from your exercise, from your diet part, the rest and recovery, everything will be taken care. So when you take this in a holistic way, your condition will be drastically improved. So it is generally, when you see all together, it is nothing but an integrative approach where the condition is drastically improving through a simple lifestyle change, and nutrition is key here, which will be completely guided, and this will help you in the recovery. And to prevent the condition, it is very important to diagnose it earlier and to start the treatment earlier. So this is all about the condition. I think you understood what is the basic things. So try to follow all these things. You can reach out to our hospital, reach out to our clinic for any further verification or any further doubts about the condition. So generally, people will ask about certain questions like can we take curd or can we take milk? Can we eat all those things during this condition? Yes, of course, you can take curd and you can take milk. It is going to support the condition, it is not going to deteriorate. And same thing about the fruits, you can take good amount of fruits, not the juice part. You can take complete fruit, that is going to help you in recovery, so that will also not worsen the conditions. These are the basic questions people will generally ask when they are under the treatment. So all these things you can take. Don't go for too much outside food which is going to burden your body, which is going to reduce your digestion or appetite. Then also the recovery will be very late. It is mandatory to follow proper diet routine and proper sleep routine, proper physiology to recover from the condition. So this is all about this thing. Um, if you have any doubts, you can reach out to our hospital. Thank you.
So we extend our heartful gratitude to Dr. Sobiha for delivering such an enlightening and impactful health talk. Your session was not only informative but also deeply inspiring. So, we would also like to express our sincere thanks to our respected principal and management for providing us with this valuable opportunity to learn and grow through such meaningful sessions. Your continuous support in promoting health education is highly appreciated. A big thank you to all our viewers for joining us and making this session a successful. Stay tuned for our upcoming Health Talk series. Until then, thank you from JSS Science.